Hi guys. So I promised that I would share with you my experiences from my clinical rotations in the ER and the ICU, and I was there last week. So I just wanted to give you an update this week to tell you about how those rotations went for me. So good and bad. They were both learning experiences, so it was really great. I'm glad to have the opportunity to have seen them both as a student. Oh, I'm losing my shirt. Okay, so we'll start off with the one that wasn't so great. So my ICU experience. There was not very much collaboration in the ICU. The RN that I was working with wasn't really the nicest person. The physician's assistant kind of seemed like she was competing with the RN. The doctors were not really in agreement, not really working well together. No one worked well together. They were all kind of working against each other. The patients themselves were all really ill, obviously. It's an intensive care unit. Most of them were intubated and on ventilators, so there was lots of suctioning and lots of care for that. All of their meds were either IVs hanging or IV push meds, and they're just all obviously on monitors with their vitals being taken constantly. And the nurse that I was working with, and I guess most nurses there, had 2 patients. So in an ICU setting, you would have only 1 to 2 patients, but there's constant charting, medicine's constantly running, and you're always just, I don't know, kind of craziness. So I didn't really enjoy the experience there, and based on that, maybe it was just an off day for the people there or a weird shift, but based on that experience, I wouldn't be looking for employment right away in an ICU setting. So the other one that I did was ER. Oh, okay, first, before I get to ER, in ICU, I did get to see one procedure being done, and that was a thoracentesis. And if you don't know what that is, it's when someone is having difficulty breathing because of a buildup of fluid in their chest cavity or around their lungs. They can take, I don't know what the word is, but a sharp, so they slit the skin, and then there's like a sharp catheter and tubing, and they would feed that in between ribs into the thoracic cavity and drain out whatever fluid. So out of this patient that I saw, they drained out 1,500 ml. So that's a lot of fluid, and the guy did breathe easier after all of that fluid was drained. Okay, so that was, I guess, probably the neatest thing that I saw there. I didn't really like it because they were all of the patients were unconscious, either on their own accord or because they were sedated and paralyzed, and it was almost like treating corpses, so I didn't really care for it. Okay, so then the ER. When I was in the ER, I got to work in the trauma center, and that was really neat. So during the shift that I was there, well, it was not a whole shift, but there were 3 patients that came in, 2 brought in by ambulance, and 1 was a life flight. And it was really neat. I got to see the assessments, and there's so much collaboration in the ER. It was fabulous. There are nurses, doctors, surgeons, anesthesiologists, CAT scan, x-ray, techs, lab people, everyone working together for a common goal. And it was really great, and it was great to have a doctor to work with so that if you needed a med or a lab or any kind of order, you had it like so fast because the doctor was right there. Also, the charting in the trauma part of the ER anyway is done on paper. The rest of the hospital is internet, or not internet, but computer charting. So I really like computer charting, but in the trauma center there's paper charting, but it's like really simplified. It's not as in detail as it is for the rest of the hospital. So I really like that, and you should still write a nurse's note in the computer system just in case the paper gets lost or who knows what, you have to cover yourself. So saw lots of really neat things in the ER. Like, for example, they have this machine, I don't know what it's called, but if a person needs chest compressions, the nurse doesn't have to be there like doing it, or anyone for that matter, because they have a machine. So it looks kind of like, I don't know, like this, with a pogo stick kind of looking thing coming out of the middle, which would press down. So this way everyone's hands are free to administer meds or do whatever else needs to be done. So that was really cool. Also, what I thought was really neat in the trauma center is for pediatrics. If they have a pediatric trauma, they have this measuring stick where they would have the child lay down, and however long or tall the child is, it correlated with a different weight and size. So, for example, a child of a certain size should approximately fall into this category of weight, and it's kind of like a cheat sheet for everyone in the ER. So if a child is this tall and this weight and he's having respiratory distress, then you treat with this med in this order, and you do this and this and this. And for lots of problems, it's all written there. And every height and color, or every height and weight, is coordinated with a color. So say, for example, it's a red child, so you would go to the red drawer of the pediatric crash cart. If it was yellow, then yellow. If it's blue, then blue. Green, then green, etc., etc., etc. So everything is really handy, super organized, and I really like that. So your day in the ER, in the trauma at least anyway, it would start off with a check of the trauma bay, making sure that you have everything that you need for your shift, all of the supplies, all of the meds, everything is set up as you're waiting for something to happen to people so that you can come and fix them. And then lots of waiting. So you're waiting for someone to come see you. And when it was slow, you would float onto the regular ER floor and see if you can assist anyone else out there. So I really enjoyed that experience, and I think I would like to work in the ER at some time, and I'm glad that I got to see both departments as a student. It was a great experience. So guys, let me know if you've been in the ER or ICU as either a patient or a student or regular staff, and let me know what you think. Were your opinions or experiences similar to mine? Alright, well, I'd love to hear about it, and let me know down below, and I'll see you guys in the next video. Good luck with your classes and clinicals. Bye-bye.